Hello everyone, welcome to Medfine. We are in the series of our lectures on poisoning, and today I want us to look at opioid poisoning. So this is the voluntary or accidental overdose of opioid drugs like codeine, morphine, heroin, used for therapeutic or recreational purposes. How does someone with opioid poisoning present? Someone will present with respiratory depression, hypotension, hypothermia, pinpoint pupils, and a decreased mental status until coma. When you do a mental status exam, you'll find that it will be less than 30. Management. How do you manage someone with opioid poisoning? There is generally a general management for poisoning, but beside this, there is a specific one for opioid poisoning, and we use an antidote called naloxone. So naloxone, you give a dosage of 0.4 to 2 milligrams, either IV or intramuscular, and you repeat after every 2 to 3 minutes, if not improving, until a maximum of 10 milligrams. For children, you give a dose of 0.01 milligram per kg and increase to 0.1 milligram if necessary. Our aim is restoring ventilation, and you repeat the dose or infusion. Manage complications accordingly. So in case a patient presents with opioid poisoning, maybe there is a respiratory depression, you can give oxygen and others, but note naloxone doses used in acute poisoning may not be suitable for treating opioid-induced respiratory depression and sedation in palliative care and in chronic opioid use. Alright, thank you very much. I request you to subscribe to my channel for more videos. Alright, have a nice day, a nice evening, a nice morning. Alright, thank you.